Welcome to the very first live broadcast of EQ Care's YouTube channel. My name is Dr. Rachel Goodman, and I'm a clinical psychologist at EQ Care here. And I work at home some of the time, now all of the time, as my office closed yesterday due to all of the issues that are happening across the country and across the world. We are ready right now to help Canadians with their mental health concerns. Just head over to the new eqcare.com for more information. The goal of this question and answer session is actually to provide suggestions for managing our mental health and wellness during social distancing, or if you're in this situation in social isolation, which can lead to many challenges for your mental health. We will not be discussing what COVID-19 is or explaining to people the rules of social distancing and or social isolation. We will leave those decisions to the public health officials and the medical professionals, which I must say are doing an incredible job, and we should all owe our appreciation to them. We're going to focus on mental well-being today. First, I just want to go over some mental health tips during crisis times, and then I'll take some of your questions. So the unknown is really making people very anxious. Some anxiety is very normal. It's normal that all of us are feeling nervous because we don't know what's going to happen from one day to the next, and we keep getting conflicting information. But the level of anxiety needs to be kept at a level that's manageable for us. And when it gets to be over the edge, then it's a problem. Let's understand a little bit about the science of anxiety. So the reason that our bodies work this way is that we were built for a time where if we lived in a cave, for example, and a saber-toothed tiger came in, we would need to be able to respond by either freezing, which would not be the greatest response, or fleeing, running away, or fighting, all of which could be appropriate responses in that time. And right now, our bodies and our brains feel like we are fighting a saber-toothed tiger, which is the pandemic right now. So what's happening is that our bodies are going into what's called the sympathetic nervous system, and it's being turned on, and it is emitting a hormone called cortisol, which is the stress hormone in the body. And it's very helpful in terms of allowing us to be able to fight or flee or freeze in that situation. But right now, when you're socially distancing, you don't need to be at that height of arousal. And so what we want to do is learn how to calm our system using some different mental health tips and some stress management techniques, and understand psychoeducationally what we can do to best help ourselves. It's also important to know that the more nervous you get, the less your immune system is able to fight off any sort of virus. So it's actually not healthy for us physically, especially now, to be even more nervous than we need to be. So we want to keep this in check. As you may have noticed, panic is highly contagious. And if you see somebody going to the supermarket and buying 50 rolls of toilet paper, that just makes you more nervous. So in fact, we want to realize what is appropriate and what is not. I'm going to give you some general tips from the kind of therapy that I practice called cognitive behavioral therapy. Firstly, we want to educate ourselves. So you want to use a reputable site to gather your information, a trusted news site, and check it really only once a day for a few minutes. I understand that there is so much going on and so many news reports coming at all times of the day. And if we talk about social media, it's thousands of times more that. But we want to really avoid doing too many checks. If you enjoy looking at social media from a socialization perspective and seeing how your friends are coping and watching fun videos of all these different celebrities who are posting things and sharing free concerts and comedy shows, that's wonderful. And we'll talk about that after. But in terms of checking the news, it's really not good to be overwhelming yourself and obsessively checking. You want to separate out what is a factual threat from what is a real threat. A factual threat from what is a perceived threat. And your thoughts can increase your anxiety if you get stuck on all of the threats that are not really factual. We want to focus on the positive. This is an unusual time, and many, if not all of us, are in some way or another stuck at home. And we can look at it as that, stuck at home. And there are people who unfortunately are alone, and we need to be looking out for those people and checking on them and, offering to do them favors and go food shopping and just FaceTiming and making sure that they're okay. But if you are with your family in your home, we have to consider ourselves lucky. If we are well and we're just at home socially isolating ourselves, what that means is we have a very special time to be with our families, with our loved ones, in a way that we don't normally have, and we certainly don't normally take advantage of. We're always very busy running from place to place. The kids are usually in school. We come, we do homework, we rush, and here we are with this opportunity to kind of do things on a slower scale, on a smaller scale, but still a very important scale. I think it's important for us to know that we cannot control everything, but we can control certain things. We can control that we are following the rules of social distancing or social isolation. We can control that we are taking care of our immediate families and our extended families by ways of protecting ourselves. And we can control our reactions to this situation by not becoming overwhelmed, if it's possible, by doing things that make sure that we're caring for ourselves. One of the ways to do that is to keep a somewhat regular schedule. Obviously, things are crazy these days, and most of us are not working. Our kids may not be at school. There are, financial losses, and we have a lot of concerns in a lot of different areas. But it's very important, especially for the kids, but even for ourselves and for older people, to maintain some form of a regular schedule. So that means getting up at a somewhat normal time. It may be later than when you normally do, but still getting up every day, getting dressed, eating nutritious meals, getting exercise, which is extremely important for your mental and physical health, and taking breaks, spending time with your family, and getting enough sleep and going to sleep at a somewhat regular time. Now, obviously, we have to consider in terms of physical exercise that we're probably not able to do what we're used to. My daughter's basketball team, unfortunately, or fortunately, got to the playoffs, and that was canceled. Most gyms, or all gyms, are closed. Many of us are used to doing exercise outside. So we want to kind of keep in mind that the physical exercise is still very important. There are so many things available online right now, trainers who are putting out free videos, physical exercise, yoga, other kinds of things, whatever you like. It is still safe to go outside and go for a walk, whether it's alone or if you're going with a friend, if you're maintaining a safe distance as prescribed by public health officials. Obviously, we're not congregating and having big basketball games, but to get fresh air and be exercising outside is very important. We also can do very simple exercise inside the house. We can be creative, running up and down the stairs, doing jumping jacks, push-ups, all of these kinds of things. And as I said, there's so many opportunities for links to YouTube videos and other things where you can, learn from different trainers who are wonderful in giving out all this free advice. We have to remember in terms of nutrition, and I am not a nutritionist, that staying at home all day can make it very easy to just snack all day. But that is not healthy. It's not healthy for our physical health. It's not healthy for our mental health. We want to keep our blood glucose levels intact, and we want to make sure that we are eating nutritious foods and, not snacking all day, but having regular meals and snacks in between. Some people tend to use alcohol and drugs to cope with stress. While it is completely normal to want a drink, at this kind of time, We need to avoid using alcohol and drugs excessively to cope with our stress. I think it's important for us to talk about social engagement, which is kind of a funny thing to say when we're talking about social isolation, or at least social distancing. So we want to stay connected with people as much as possible. If you can, going to visit a parent who is stuck at home, an older person, and stand at the street and at least let them be able to see your face. But if not that, to be on video, FaceTime. I'm on YouTube right now seeing all of you, at least on the phone, and have a support system of people that you can talk to when you're feeling anxious or nervous, or at least to just let off some steam. You can arrange virtual dinner dates with your family and friends, online coffee dates, and attend meetings online. Again, there are so many free and I guess paid things that are being offered right now globally by people all over the world. And you can join those things and know that you are at a concert with a friend who lives across the world, and you're both watching the Indigo Girls, for example, which I think was on today. It's also really therapeutic and important to reach out to others and to check on them for their sake, of course, but also for your own, to see how people are doing, to look and see if you can do something to help somebody out, to make sure that you are, looking out for the people who are more isolated and more in danger of feeling lonely, because loneliness is really a problem in terms of mental health. We're going to talk a little bit about coping skills for stress. Now, I will introduce some coping skills that psychologists in general teach people, but you can just think about what you yourself tend to use when you're feeling upset or nervous. The first thing that comes to my mind is music. Music can be a wonderful way to either calm yourself or to improve your own mood if you're feeling down. I just spoke with a patient and I recommended to her that she put on the music and dance with her daughter in the house, and she loved that idea. So these are things that we can do. We can take a hot shower or a hot bath. We can, obviously there's comfort food. There are coloring books, painting, any kind of art, any kind of journaling, writing. All of these things are good relaxation techniques. If you play a musical instrument, that is a wonderful outlet as well. In terms of those kinds of relaxation strategies that we recommend to people as psychologists, we can talk about coping skills like breathing retraining or breathing exercises. And I'm sure that you can find many links online. You can look up diaphragmatic breathing or breathing retraining, and you can learn how to breathe. The essence of that is basically focusing on taking a nice inhalation through the nose, but then pausing and stretching out your exhale as much as possible from your mouth. That is where the physiological relaxation comes from, actually, the exhale, not the inhalation. And we recommend that people do that a couple of times a day, every day. And that's something that you can do alone or with your kids. And it's very simple, but can make a very big difference. Mindfulness has become very popular, and a lot of people have heard of it, but they're not sure what it is. The idea of mindfulness is learning to be present in the present moment without judgment. And there are plenty of different ways to do this. You can look up on YouTube or you can Google mindfulness, and there are so many videos explaining how to do this. It can be as simple as just taking an orange and peeling it, smelling that citrus smell that comes out of the orange when you peel it, and then eating it and feeling the juice in your mouth and being present and really tasting the orange. And what that helps you to do is really be in the moment rather than inside your head, thinking about all the things that you're upset about that happened in the past, or worrying about all the things that are going to happen in the future. But we are so lucky that there are so many different apps and websites for mindfulness these days. and so many wonderful ones. One is not better than another. I will mention a few just because I practice with them and use them in my practice. One is called Calm, CALM. Another is called Headspace. And a third is called 10% Happier. And a nice thing that I've noticed, along with all these other companies that are offering free resources these days, is that 10% Happier is having every day at 3 o'clock a free mindfulness session. But I'm sure all of these different companies, and I don't want to endorse one over another, are offering free resources right now, and they're really worthwhile to try them out. And you'll see there are for kids, there are for adults, and they're really wonderful in terms of helping to calm yourself and coping with the stress. Of course, for people who enjoy yoga, that is a wonderful thing that you can do. And try some of these other, exercises and routines that are out there for coping skills. Another thing that we want to think about is reframing your thinking. So what's happening now is that we are all of us, I include myself, kind of focused on what we don't know, what we can't control. This is a very scary time. For some of us more than for others. I feel very fortunate that, thank God, nobody in my family is sick at this time. We may be separated in different cities and in different houses, but we're all very fortunate to be well. And there are people out there who sadly are not well, and we need to count our blessings. But it's very easy to get caught up on the fact that we can't control things. And what we need to think about is, as I said before, what we can control. And, that's being at home, staying safe, trying to be with the people that we love, and use this opportunity to kind of calm yourself, to do things that maybe you haven't done in a long time, and you used to play the violin and now you're going to take it up again, or that you want to call a friend that you haven't spoken to in a long time and you've been so busy. But I think it's very important for us to focus on what we can do and not so much on what we can't do. We also have to remember that while this is really very scary times, that there are people out there who are responsible for making sure that all of this gets done properly. And as I said before, there are amazing public health officials and mayors and premiers and government officials in different countries, especially in Canada. And I have to say now, living in Quebec, Premier Legault has been incredible in his leadership of our province, and the way that he has been leading us in terms of making sure that everybody does stay safe, and that the medical professionals in the hospitals don't get overwhelmed with people coming in unnecessarily. So I'm getting some questions. I'm going to go to the questions, and you can keep them coming. One of my colleagues does daily online family meetups. How does this help? That is wonderful to hear that they are doing that. So this allows you to feel less isolated and feel connected with your family while you are not able to actually see each other. That I don't know if this family actually lives in different cities or in the same city but in different houses. My family is planning on having dinner together tonight in 3 different houses. And we may all be eating different things, but we will all be joining each other this evening to go on a Zoom session and eat together, because we can't do it otherwise, which we normally do. So that's really wonderful. Another question. My friend watches the news constantly. Is that healthy? How can this be remedied or avoided? As I said earlier, watching the news constantly or through social media is not healthy. I don't really believe that you're getting anything new by obsessively reading. All you're doing is making yourself nervous. As I suggested earlier, I think most experts are recommending that you choose 1, maybe 2 news sources, and you check it once, maybe twice a day for a short period of time. I do believe that in this day and age, if anything urgent happens, because we're all so hooked up technologically, we will get that information if it needs to get to us. And just checking over and over should not be done constantly. Another question from one of our members: how do I deal with working from home while taking care of 2 children? Well, that is a very good question. I am doing that myself. I think it's a challenge. And on the one hand, we have to have a conversation with our family members about kind of balancing things and making sure that the kids, obviously, they have to be a certain age to understand this, but can understand what's going on, and that they need to give you a break at certain times of the day, and you have to make a schedule with them where they become part of that schedule. And if they're not too young, every child can take part in taking an ownership over making a schedule and feeling good about it. And you can get them involved in making meals and preparing and cleaning up the house. And you can give them projects to do in their own space quietly while you are in your workspace doing your work. Now, I realize not everybody has this option, but if it is possible, it's very important for your mental health to be creating separate workspaces from your living spaces. And again, as I said, some people may not have that possibility if they're in small apartments and you're working at the dining room table. But if you do have a separate space that you're able to go to and then leave that space when you're taking a break from work or when it's the evening, I think that that is ideal in terms of being able to separate yourself mentally from your work. Just going to see if we have any more questions coming along. Let's just hold on. I'm going to go down the screen. Okay, another question. I worry that some of my family aren't taking things seriously enough. How can I get through to them without causing them to panic? That is a good question. And first, I will say I am not a public health official or an infectious disease specialist and don't feel equipped to be able to kind of tell somebody what is and is not correct in terms of what we should be doing now, other than that I am following all the rules of social distancing. And I think that it makes sense for you to be able to tell your family, we care about you and we want you to be safe, but we also want to make sure that everybody else in our community is safe. And I will say that while some of it can be upsetting, there are a lot of videos and articles from other countries, especially Italy, of people who are now kind of talking to their 10-day-old selves and explaining to people what they should have done 10 days ago. And that may have some influence on your family members in terms of them being able to see, hey, here are people who are going out to restaurants and going out to bars and doing other things, and realize they shouldn't have done that. They should have taken things more seriously. Okay, next question. My mother lives in another city and has to care for her grandchildren as well as her son. How can I keep her healthy while she's taking care of so many others? So I think this is a reasonable question. And obviously, you living in a different city, it is hard for you to be able to sort of push her or kind of affect her behavior, but you can only talk to her and tell her again that I care about you, and that for people who do have to expose themselves to other people, and there are many, many people who do still have to do that on certain levels, whether it's bus drivers or medical professionals or otherwise, or your grandmother, or sorry, your mother, that you have to be taking care of making sure that you are following the general health practices of washing your hands over and over and over again, and wiping down services, and making sure that if she is caring for them as much as possible, keeping a distance that's recommended by the public health officials. And that's, I think, the best that she can do. Another question, is there anything we can do for our neighbors who are new immigrants to the country? Most of their support system is on another continent. How can we help? I think that's a wonderful question. I think that we are responsible for our community members, and it may not be our immediate family, but we are all responsible for one another, and especially for people who don't have family here. So I know that I can say in my community, there are many, many organizations that are making sure that these communities and these immigrants or people who don't have family members are being cared for, and you can go and volunteer with those organizations, whether that means you leaving your house if you feel comfortable to go food shopping for somebody, or making phone calls to somebody who's isolated so that they don't feel so isolated, even if you're not actually going to see them. Making sure that people are, especially these immigrants, aware of what government resources there may be for them. And I'm not sure what those are, but to make sure, that they know what's going on, because especially if there's a language barrier, they may not be aware of everything that the government in that province or city is doing for them. Okay, I'm getting a question. How do I cope with being shamed by others for being vigilant and following recommendations? So that's a great question. I think that on the one hand, we have to feel comfortable with the decisions that we're making for ourselves and what we think is right, and know that people are tense right now. And really, it's important for us to kind of love one another and care for one another rather than be spending time shaming other people. And I think you kind of have to just tune out the naysayers. I know that's easier said than done, but there's so much good going on right now. Seek the good. Align yourself with people who are doing positive things. Spend your time doing something positive to help your community or your neighbor or your family. And I guess don't focus on what the naysayers are doing. However, I will say, if you have somebody who is not shaming you, but expressing concern about your behavior because they're concerned that you are kind of acting on your anxiety, and you're hearing that from more than one person, but numerous people, that may be something that you want to pay attention to and see, am I going over the edge? Am I starting to be affected by this situation mentally? And what do I need to do to kind of take that back and get back in control? Is it best to balance the work with home tasks? Sorry, I'm trying to read a question and I'm not really understanding it. Is it best to manage and balance the work with home tasks? If I understand the question correctly, I'm guessing that what this person is asking in terms of scheduling is, should you be balancing your day if you have laundry and cooking and all of those things to do and caring for your children with your work? And I think that's a very personal question, depending on what your work is and if it allows you to do that. So if you are working from home and you have a boss that you are answering to, and you still have a 9-to-5 schedule where you are having to, be on meetings regularly, you may not be able to do that. And you may be keeping your schedule just as you did before, where you were doing your kind of home tasks after work, so to speak, even though you're at home. If you have a bit of a more flexible schedule work-wise, then yes, that could be a great idea. And as I said before, if you have children, getting them involved in the home tasks, I think is a great idea. I saw something on Facebook that somebody had posted where this is the opportunity for kids to learn real life tasks, and that they may not be in school, although many schools are having virtual learning. And I have to give credit to my children's school, which is doing an incredible job in terms of the e-learning and the teachers and the effort that they are making. But here's their opportunity to also learn what it means at home to do the laundry and to make lunches and all these things that maybe they don't do on a regular basis. Next question. Are you or other therapists offering online sessions for their patients and even for people who are not their usual patients during this time? So that's an interesting question. I can't speak for everybody. My understanding is, and I've been seeing tons and tons of articles online on my LinkedIn and through the Canadian Psychological Association and the OPQ, where I live in Quebec, and other resources where, yes, pretty much everybody has gone online. Even if some offices are still open, most people are offering sessions through Zoom or other video platforms. They're also sometimes doing phone sessions for those people who can't do video sessions. And yes, I am definitely offering sessions online. I think most people are. Most places that I've seen are offering that. And I would imagine that, yes, if somebody is not a regular patient, meaning they have not yet participated in therapy, but now are feeling that they could benefit because of this current situation, absolutely, you should reach out and see what is available. And there is so much that's available. I think that on our website, on EQ Cares, we will have some resources. And if we don't as of now, I'll make sure that we put some resources on the website. And you can look at your local order of psychologists, or as I said, Psychology Today, the American Psychological Association, Canadian Psychological Association, etc. Okay. Next question. So many questions coming in. This is great. A friend of mine is trying to help so many people and doing so much providing support. I am concerned. How can I communicate this to them? Okay, I think that is a wonderful question. And while I am sitting here and suggesting to people that one of the things that you can do to care for yourself is to care for others, you have to make sure that you are caring for yourself as well. And what that means is checking in with yourself or checking in with your family members and saying, do I seem okay? And checking in with one another. And if you feel that you are stretched to the limit, sometimes you have to take a step back. So I think you can tell your friend that you're very proud of them and impressed with what they're doing, but you're worried about them and you'd like to do something for them. What can you do to help them? Just a thought. How do I say no to organizations that are asking for help? I am trying to do my best. I feel guilty saying no. So I'm not sure if this person is referring to organizations that are asking for physical help or financial help. Obviously, every organization right now is suffering immensely from a financial perspective and from a physical perspective, because they don't have the volunteers that they normally do. And there are places that are closing. And yet this is a time where we really need as much help as possible. So again, I think that it's a balance. It's important for you to learn to say no and to know that you yourself have to take care of yourself and your immediate family. And at the same time, maybe think about, is there one organization that's meaningful to me that I'm going to dedicate myself to? Or is there one charity that I really feel right now that I'd like to give to? And maybe I can't give the amount that I would normally, but that's okay. But that I am, making sure that I am giving of myself in whatever way, but in a reasonable manner so that I don't stretch myself too thin. Okay. Another question. What are some ways I can keep track of my mental health status so I don't burn myself out? Or what are some warning signs that I might be burning out? Okay, well, increased anxiety symptoms like heart racing, sweating, headaches. I'm trying to stay away from the COVID-19 symptoms so we don't get confused, but some of them do overlap in terms of the trouble breathing. Not being able to concentrate on things, having memory problems. These are signs of anxiety, some signs of depression or stress, as we would say. Trouble sleeping. And trouble sleeping right now is very reasonable, but I think it's a matter of how much trouble you're having sleeping. And again, like I said, I think we are spending a lot of time with our family members, and that's a good way for people to be able to check in with us and see, oh, have you noticed a change in me? And allow the people around you to be able to be mirrors for you, because that's what we're here for. Good question from the audience. How do we balance positive thinking and the benefits it brings with staying vigilant and safe and the dangers of the panic that those thought patterns can incur? Okay, that's an excellent question. I'll go back to what I was saying before. So I'm not so much talking about positive thinking as rational thinking. This is not about looking at the glass half full and pretending that nothing is going on. That is not what I'm saying. First and foremost, we need to be safe. We need to listen to the public health officials, whatever your mayor or governing official is telling you, and staying safe and washing your hands and staying home and limiting your exposure to people. I can't stress that enough. But at the same time, we have to recognize, like I said, assuming this is the case for you, you are well. All you're being asked to do is stay home. Again, I've been reading, I guess, a little on social media, and I saw something that I really liked, a meme, which said, your grandparents were asked to fight in a war. All you're being asked is to stay home. So I think we can understand that what we're being asked of us is not so hard, and that we are very lucky to live in the time that we do, where we are able to be home, but at the same time not be socially isolated. And that we have access to telephones and to computers if we have in our homes, and to social media and to other outlets, and that we can stay connected with one another and we do not have to feel isolated. In addition, again, I'm not an expert in terms of what food or items are out there and are not going to be out there, but I do believe that all the government officials are telling us there will not be a food shortage. We live in a time where we don't live in Russia. We don't have to line up for food, and we all have plenty in our homes, or we've had the opportunity to get it. And, we're going to be okay. And we have to keep telling ourselves that in the immediate moment. And again, tomorrow things may change, and that's very scary. But we have to try to stay positive, but really what we're talking about is logical and rational. How do you suggest to reset mentally at the end of a long day inside? Okay, very good question. So I think that really depends on what you like. If you're the type of person who likes to get outside into the fresh air and take a walk at the end of the day, and that will help you to sleep, go for it. Go walk around the block, and come home and eat something and take a shower and get into bed. For me, I'd like to get into bed after a long day, after I've, done my work, I've interacted with my kids, I've checked in on their work and their homework. I like to get into bed and watch a show. I think we all have plenty of Netflix shows and other shows that are available. For me, that's relaxing. Obviously not a good idea to stay for hours and binge, because you do need to sleep. Sleep's very restorative right now, but I think that it's really to each his own in terms of what works for you. But it is important to have something at the end of your day, reading a book, if you've been saving a book and reading a chapter every night, also obviously a wonderful thing to do. As I mentioned before, the mindfulness or the breathing exercises can be wonderful things to do in bed to calm down, to slow your system, to help you to fall asleep. A couple more questions and then we're going to have to end. Okay, what are ways I can help my spouse if they're having trouble coping during this crisis? I think we did address most of that. If I get overwhelmed, what are some good ways to manage without cutting myself off from information entirely? So as I said, I think important to pick one or two news sources. And if you are looking at social media, really probably better not to use it as your news source, but use it for fun, for lighthearted videos and articles and really connecting with your friends. I think that is what social media was originally designed for, to be able to connect with people who you don't see all the time, who live in different communities, and you can check in with those people. Okay, last question. How to manage taking breaks. I do not feel like I want to sleep as much as before. I am awake until 1 a.m. and get up without any problems at 6. I do not feel tired. Is this normal? So again, I can't speak to a particular individual, but I do think that for some people, the fact that we are staying at home all day, we're not expending as much energy. So maybe we don't need as much sleep. I don't want to suggest that people should not be sleeping properly at night or should not be giving themselves the opportunity to, but it is possible that for some people, they are not expending as much energy and therefore are not as tired. Probably a good idea not to be taking naps during the day, especially if you're not able to sleep at night too much. Okay, so I want to thank everybody so much for joining me for this first live broadcast on EQ Care's YouTube channel. Don't forget that members of the EQ community can log in at any time to get mental health guidance during this crisis or for any reason, 24/7, all year in English and en français, anywhere in Canada. It's been a pleasure speaking with you today. My name is Dr. Rachel Goodman. Take care and stay safe.